Welcome back to All Therapists Are Jerks with Ulland
and Jo.
In this episode, we're going to be continuing to follow along with our reality acceptance skills. And today we want to address turning the mind, willingness, and willfulness as concepts to be reviewed. And I think they're important because often we can have a conflict within ourselves and be fighting against changing in positive ways or doing effective behaviors. It's very common, I just think in general, but I think also with families and clients we work with often have a difficult time with behaviors that get in the way of their making progress.
Right. And I think turning the mind is, extremely important. It's the kind of the cognitive piece of the reality acceptance skills. So it's being able to recognize that your thoughts are those reinforcing the non-acceptance of reality, and then being able to turn your mind toward acceptance again. Because remember last time we talked about radical acceptance and radical acceptance being like a verb. Mm-hmm. And so this is an extension of that. So radical acceptance is kind of the mind, body, soul kind of connection of acceptance. I'm sorry, the body, soul kind of connection to radical acceptance, but then turning the mind is the cognitive piece, mm-hmm. and then willingness is the action piece of it. So I think with turning the mind, we like to think of it as like facing a fork in the road. So the mind must be turned onto the acceptance roadway versus like rejecting reality. And we are going to talk about mindfulness of current thoughts in another podcast. Mm-hmm. So these all kind of tie together, but being aware of what your thinking is telling you and recognizing that your thinking is telling you that you're not on the path of acceptance, and then actually making the choice to turn the mind.
Right. And then again, it's kind of back to, I like the Eastern philosophy of like being on the path. You have to do it over and over again. So it's not like a one time and you're done type deal. It's just this process that you work at to try to get good at, and requires a lot of awareness, where again, mindfulness, even though we haven't yet spoken too much about mindfulness, becomes this very important piece to really being skillful and effective all the time.
Right. And then turning the mind itself is not equal to acceptance. It is, again, it's that path. It's the path of being able to get more closer. I don't even think that's proper English.
Most closest.
I'm going to be the closest one. But it is the way of getting closer toward the acceptance, and being able to recognize and accept the fact that it can take longer to arrive at acceptance than maybe one would think. I think it's very easy when you're talking about these skills to think that, wow, it's just that easy. I just have to decide to accept reality, mm-hmm. Except for that your mind and your body aren't always jiving. So
yeah, it's true. I guess I hadn't really thought about it when you said it that way. It's very clear. Like, it's not like sometimes we're not integrated, so to speak, with what's going on. Like, you're right, your body could be kind of wanting to be there, but your mind is going the other direction, or vice versa.
Yeah. Like your mind could be like, no, I need to accept this. I understand that I need to accept this, but you still have all of the emotional intensity, mm-hmm. of the painful emotion, even though your brain, mm-hmm. Or you can, in one moment, you could be saying, like, denying reality, like, it shouldn't be like this. And then you can tell your mind, oh, well, shoulding it doesn't really make it different. It is what it is, and trying to get back to that acceptance piece of it. And then like 30 seconds later, if that, maybe even 2 seconds later, right. Your brain is right back to the shouldn'ts.
Right.
So it's consistently trying to come back to that. I'm recognizing that I'm having judgmental thoughts about this. So how to turn the mind is observing that you're not accepting. And mm-hmm. again, that is going to be kind of a cognitive piece of things. Actually, sometimes when we're not accepting reality, there'll be some physical ways that we recognize it too. We'll have more closed off body posture. Maybe we'll have our fists closed. And that we'll talk about when we talk about half smile, willing hands. But, so our brain and our body will often be telling us that we're not accepting reality. And we have to be able to observe that. And then we kind of have to make this inner commitment to accept reality as it is. Like, I don't really want to. That's another piece. A lot of times I don't want to.
Right.
And like, I don't want to, and I know I need to. So it's, I don't want to, and.
It's such an active thing. Like committing, it really is that strong. Like, you have to, at some point, you're going to be like, I'm choosing to do this.
Right. And then you have to actually do it. And you have to do it over and over and over again.
Yes.
And then sometimes we have to actually develop a plan to catch ourselves when we step off the path of acceptance. And I know for me that, that for me comes from a cognitive place first. Like, I'll be like, oh, yep, there's those judgmental thoughts again. I don't really want to accept this reality the way it is, and that's not helpful for me. So my plan might be to, I might start stringing together some skills. Mm-hmm. So I might do mindfulness of current thoughts. I might do half smile, willing hands. I might do a body scan. So there's a lot of different things that we can do to get ourselves back toward radical acceptance or reality acceptance. Once you know some skills, once you know yourself and how you function, you can actually come up with a plan for how to get yourself back on track as quickly as possible.
And I think it's helpful to build on previous successes. So if you can think of other times where you can remember like, oh, I got to a place of acceptance with this really difficult issue. Well, how did you do it? And you want to try to build on success is important. I think it's also would be helpful for listeners to really actually let's define like what willfulness actually looks like or maybe even feels like, because that idea you have to observe it first really before you can kind of move into committing to having a strategy to face it. So often willfulness will feel like, refusing to tolerate the current moment.
Yeah, that's like totally me. So in my brain, what I think of when I think of being willful is I think of like a 2-year-old, like stomping their feet and like throwing a tantrum, like, no, it is not. This is not how it is. I don't wanna, like clenching your fist, stomping your feet. Like in my brain, I literally think of myself as like a little kid throwing a tantrum.
I get stuck at almost like I think the adult version, but it's still a childish thing, is like the efficiency of it. I should not have to respond. Yes. I shouldn't have to work harder because this person next to me. And so just like I wouldn't have to if, I have that point of view in my mind. It's not helpful. It's just here we are, and might have to work harder, which is interesting because I like Stoic philosophy, but that emotional peak of like, I shouldn't have to do this. Well, that's me saying, look, the universe dropped something in my lap and I'm like fighting with it or venting about it. And it's just like, if I'm in my proper Stoic way, right, I would just say immediately, oh, here's this thing I'm working on that's in the path to my goal. I'll work on this and continue on my path. But the first initial thought is like, oh God, here's this other thing someone dropped on my plate.
Right. One more thing.
Right.
I like too that, I wanted to jump in a little bit about you talking about willfulness. I like that we're doing a discussion about what willfulness is, because willingness is that third piece of the reality acceptance, and the willingness is the actual action required to be able to accept reality as it is. And so there are a lot of ways that we get in our own way. Like we might have the awareness that we need to radically accept something, but we still have to actually do something to get ourselves there. So I like the fact that we're kind of hitting willfulness before we go into willingness.
I think it's interesting. And I think also I like the several layers of the way that DBT, the principles can be very layered. So like if you come back to, we several times, I think we've kind of talked about this idea of like getting in our own way, which is accountability on some level. Like, so if I'm getting in my own way, I have to be accountable to the fact that I'm doing that.
Right.
And I don't, I've studied different types of psychotherapy, moving your way through training in psychiatry, we do this. And it just never saw a focus on the idea, like, in a very non-judgmental way, like, usually in other therapies, if patients getting in their way, it's like characterological or, like it's kind of judgy. But then in DBT, it's like, no, it's expected because you do it yourself. Therapists get in their own way all the time. So like it's this deeply human thing that we kind of do, but it becomes part of the therapy and it has to be tended to. Like how are you going to move forward if you're like in your own way? So let's work on that first. I like the layered approach with DBT.
I got to tell you, I got a ton of willfulness when it comes to documentation.
Yeah, me too.
I just want to help people. Why do I have to document it? God.
Is it really any wonder why, like, in consultation group, documentation is supposed to come up if if we're behind?
Exactly.
Marcia was onto us ahead of time.
Totally. Well, and I think that people that work at higher levels or more acute levels of care, like that documentation piece of things is so intense, especially for us trying to get the length of stay that we get.
To me, it becomes like almost like meaningless. Like I just had this session, or we've done so much extensive work how to document it all, and then I'm like, based on what we're doing and the value of that and the meaning to a patient and myself, it seems just like checking the check boxes. Like I'm really going to spend all my time talking about now. Like the important work is we're doing, and like it just seems so not relevant to getting people better sometimes.
And if we don't do it, we get fired.
Yes, I hear that happen.
Yeah.
Sometimes.
So there's that thing that says, was it opposite of doing what works?
Yes.
So I could go on strike and not document, but I probably wouldn't have a job. Therefore, I wouldn't be able to help people, which is why I do this in the first place. So that would be like cutting off my nose to spite my face.
Yes.
So we do that a lot sometimes, I think, especially like kids, like they want to prove a point. So they're just going to like go on strike and they're not going to eat their broccoli or something. I don't know what it is, and really all they need is to do like one bite of broccoli and they could still have dessert. I know this is a really trivial example, but that's the whole concept of like cutting off your nose to spite your face. Like I'm going to do something to just like prove that you can't control me or like, I don't want to.
Right.
But it ends up increasing our own personal suffering.
My visual statement that I like for myself is I'm just sitting there grinding my gears.
Mm-hmm.
Just like burning out my own clutch trying to move forward, but I'm just working against myself.
Exactly. I think another thing that doesn't actually appear like willfulness, like if people saw it, they wouldn't recognize it as willfulness. And that's that active passivity that's like kind of giving up, that like kind of throwing your arms up in the air and like, well, whatever, I can't do anything about it anyway. You know, that is actually willful. I don't know.
Quote, I don't know.
Yes, I don't know is my favorite.
Right.
And we get that in sessions so many times, especially in the beginning, like, oh, you know, what are your goals for treatment? I don't know. Well, if you don't know and I don't know, we're in a lot of trouble. But it is like giving up is actually willful. I think people think of willfulness like that tantrum that I was explaining earlier.
Like it's almost like a low energy state that just kind of happens.
It's like Eeyore.
But it's actually kind of forceful.
Eeyore's kind of willful.
Yeah.
Yeah. You think about it. You think like maybe Tigger would be the willful one.
Okay, now see a mule or a donkey. I don't know what
He's
Eeyore is.
He's a donkey. He's
and
not
our donkey's
mule.
kind of known to be kind of belligerent.
Stubborn. Yes.
I'm not an equestrian type person, and you know this about me.
I do know this about you.
I made my first largest error in Parent University by saying that, what did I say, donkeys couldn't procreate, but it was mules.
Yes.
And I sadly didn't know the difference.
That was great, actually.
It was good times.
Good times.
Fallibility. So the other, sometimes willfulness can actually look like someone trying to fix every situation, and that can seem very controlling. And often I think we see that more, at least for working with parents often can do that. Wanting strictly defined answers for what we're doing, how things are supposed to look, or how things are supposed to work, or that I think also sometimes like this focus on one problem. Like if we knew like the one problem, like I don't know what's going on with my child, but there's just like I feel like there's just this one thing, and if you address this one thing, they're going to be fine.
Yeah, I think that we get that a lot in treatment. Where we'll get usually. Well, it's equally, I think, moms and dads, but a lot of times they're trying to fix everything.
Right.
And that is actually it is a willful stance to take. So instead of accepting that your child is suffering with things like self-injurious behavior or suicidal ideation, they try to control or fix all the problems, which actually in the long term kind of handicaps the person and prevents them from learning that they're effective. But when we're trying to fix everything, that's often very willful. Or when we insist on being in control or we try to control our environment, that is also extremely willful. So what we're doing is we're trying to shape the environment to reduce our emotional suffering rather than accepting the fact that we are experiencing emotional suffering.
It's true. Also, willfulness can be even more passive. Feeling is like avoiding emotions, events, or people, or the things that we need to be doing to be, happy and effective.
And then the last thing that I'm sure a lot of you have seen Willy Wonka and the Chocolate Factory, but it's attachment to our own wants and needing that want fulfilled like right now. So like it's that I want it and I want it now. And you get like really willful and it's just like this thing must happen and it must happen now. And we're wanting that like immediate gratification, that immediate relief from the suffering that we're experiencing.
So what willingness looks like in contrast is that you're doing, really just what is needed in a situation and then doing it wholeheartedly. Like you're not taking on the entire world or like trying to control everything, but you're doing like really like effectively what must be done in the situation, what's needed, and then just doing that kind of full on, not in a perfectionist way, but just solidly.
Right. And it's also listening carefully to and acting from your wise mind. And again, I know we haven't done our podcast on wise mind yet, but wise mind is a place that we try to get to in mindfulness, that we're balancing our reasonable and our emotional minds, and we're finding a place that is a place of values, a place of meaning and purpose, and it's making a decision that is in our best interest, even if that decision is a difficult decision. And oftentimes when we're making decisions from our wise mind, they're painful. In fact, I've often heard the phrase wise mind sucks.
Right.
Because getting to a place of wise mind, our emotion minds are often so loud and we want that immediate gratification. That immediate gratification is often put on hold. So we suffer a little bit longer, experience the pain a little bit longer to be able to make a wise mind decision, which kind of comes, I've heard it be like, from your gut, listen to your gut, follow your instincts, that kind of thing. That's like the feel and sensation of wise mind. So when you're willing, you have to be able to make decisions where you access your wise mind.
Right. I think also willingness, I like this one, may not seem as tightly related, I guess, but I think it's important, is that you're trying to act with awareness that you're connected to the universe. So also part of willingness is not really just being an individual. It's also the recognition that what you choose to do and how you choose to act does have larger implications, really, even if you can't see it. I think it's helpful for clients that we treat and families you treat is they're very compassionate towards other people. They already believe that they deeply affect people in negative ways already. And sometimes they're unaware that they're affecting people negatively too. And sometimes the kind of fuel for getting better is to say, they've given up and they don't want to change this behavior. And it's like, you can sometimes hit a lot of willfulness with it, or just like, what's the point? That kind of passive willfulness. And then you're like, because actually, when you do these behaviors that seem small to you, all of your peers around you actually are worried about you or anxious about you, or they feel further away from you. So this, which is actually like that turning up the pain a little bit for them. So we talk about when they're suffering, sometimes they suffer more to get better, is like, you're not really just affecting you. And what you choose to do in this moment actually is impacting the people around you. And sometimes that actually can get residents we work with actually to start turning the behavior around because just they don't want to have that negative impact on somebody else. And then they start engaging in more effective behaviors and they might start seeing a change, or we can start tying those behaviors more into their personal values to move forward.
So I think the other part of acting with awareness that you're connected to the universe is also helps reduce suffering in a sense, because when we're suffering, we often feel as though we're suffering in isolation because we actively avoid, because we actively isolate. And we're usually in our own minds and our own body sensations and our own experience so much, we feel disconnected. And so if we can recall that we are actually connected to others, it can actually reduce suffering in and of itself. And then being able to help us move into a willing action of accepting reality as it is, and that we are not suffering alone, that other individuals suffer as well.
Mm-hmm. Yeah, I think that's really an important point, that not being in it alone. I think humans want to be connected to others around us and to be connected to others, and that the isolation that occurs with significant mental illness with a family member or within yourself actually, I think, just really worsens someone's suffering in the moment. But if you can connect back to that, I'm not really in it alone, or if you have healthy relationships around you that you can foster and build, it really matters.
Mm-hmm. So the question is then, how do you find willingness? So this is a great idea and concept. I'm willing to be willing.
Yes.
The first thing we have to observe is that we are, in fact, willful.
Mm-hmm. So much begins with observation.
Yes, it does.
And skills.
We need to do that podcast soon.
Yes.
Then you have to radically accept that in this moment you feel willful. So you have to actually radically accept the experience of being willful. There's so many times, and one of my other favorite phrases that I like to say is, do you want to be right? Or do you want to be connected? Or do you want to be effective? And there's so many times I really do want to be right. I just want someone to be like, you're right. And I can be, that's so nice to hear. But being right, it often gets in the way of our ability to connect with others, our ability to move forward, our ability to heal. And so you have to radically accept sometimes that, you know what, right now, I just would rather be right. Mm-hmm. You have to recognize you are actually being willful.
I had this conversation once with a resident where I was trying to be a little bit irreverent to try to move forward. And also, but first, before I did, I was trying to be self-involved self-disclosure. I said, I feel further away from you and I feel like we're fighting, and then she's like, well, we're not fighting. And I said, well, you just disagreed with me. So how is this not fighting? And it was funny in that moment of this, just the pure logic of the sense of oh, we're not fighting, but you just disagreed with me to tell me we're not fighting. And so how are we not fighting? And then that moment was she kind of smiled a little bit, and then it was quieter, and there was just less disagreement at that point on, and we could move forward. But it was maybe that irreverently got her to see that acceptance of, no, actually, maybe I am, being willful in the conversation. Also, we have to go back to turning the mind, going back to acceptance and willingness as concepts, and then putting that effort in making that commitment to get back to turning our mind onto wanting to be more willing.
And then there's also almost a physical component to it as well. So again, we'll be addressing half smile, willing hands in another podcast. But trying half smile in a willing posture can be really helpful. So again, if you try to imagine when you're feeling willful, what your body is communicating to others, or what is your body actually doing when you're feeling willful? I know for me, when I'm feeling willful, my arms will be crossed and my face will be a little bit scrunched up, and usually my hands will be clenched underneath my arms. Mm-hmm. How about for you, Ulland? What do you like when you're feeling willful? Willful.
I think I get maybe a general sense of tension in muscles. I was thinking probably I get willful, I probably get more of a fixed stare, not like a stare, like an intimidation stare, but my stare is more fixed. I think the muscles around my eyes are tighter.
Right.
I may look more analytical than usual, and may not have as much body movement when I'm being willful.
Right. So being able to recognize that, we have this awesome skill called half smile, willing hands, or half smile, willing posture. And that is a way of our bodies communicating to our minds that we're willing. We're willing to accept whatever comes. We're not going to try to fight it. When we have those closed off body postures, that's like us saying like, no, get away. We're not going to accept it.
I was just thinking, I was trying to recall willfulness in my body. And I think I do this thing where it's a head tilt. You know how dogs tilt their head when they're confused? I do a slight tilt like that, but also a slight rotation. So I actually move my chin off to the right and a little bit further back. And that's like, I'm like, oh, no, I'm not. That's my willful head movement.
I may or may not have seen that once or twice.
Probably a couple times. Two, 3 times.
2, 3 times. And then the other thing that we can ask ourselves is, what is the threat? So if willfulness feels like it's just not moving, like, okay, I see that I'm willful. I don't really want to be willful, but I can't seem to move it. It feels really, really solid right now. Then the next thing I usually have my residents do is like, well, what's the threat? Like, what would be the threat in you moving into a space of willingness? What would be the threat in you making the changes necessary? What would be the threat in accepting reality as it is? And we're going to get into that a little bit in a couple more minutes when we talk about my theory of stuckedness. But there are specific reasons why people do get willful, why they do get stuck.
Mm-hmm. I think that's impactful, because I think when someone's being willful, so to speak, the assumption is that they're being willful with us, or they're being willful with somebody else. And if you miss the better assumption really is like they're afraid. Like I don't do stuff because I'm afraid. If you think about like, why wouldn't I do something? Often there's some fear there. It's not me trying to be an ass to somebody. There's some worry. There's some concern. Right,
exactly. And then to fully find willingness, you have to actually be able to do opposite action. So you have to be able to fully participate in whatever you decide the willing action is.
I think the next part is good. I like this. This is you kind of learn these pearls as you practice, and these ideas kind of come together because you see through patterns of behavior or just kind of reflecting on your own life. So Joe kind of came up with this idea, and we call it stuckedness. It's not necessarily, from a DBT textbook per se, but actually it's, I think, pretty deeply in line with what we do and really within DBT in general.
Well, I think it comes from the past, 2.5 years 3.5 years, like learning DBT, practicing DBT, teaching DBT, but living DBT as well, that there's times where we just get stuck. And so I call it my theory of stuckedness, even though it's like not actually scientifically proven, or I don't really have a specific hypotheses. But I guess what it is patterns of things that get in the way of us being effective. And the first thing that I have identified, and I think it is actually very much in line with DBT, is we lack awareness. So sometimes, and I like to use a plumbing example for this, because I think it's less, personal. And I think people sometimes can see more objectively when we talk about non-mental health type issues.
Right.
So for lack of awareness, so let's say I go upstairs and I take a shower and I have low water pressure. So I have an awareness of a problem. So the problem is I have low water pressure, but I really don't know what's causing the lack of water pressure. And so I have to do some exploration, some investigation, some mindfulness to try to figure out what is causing my problem. So I think a lot of times people come into treatment and they're aware that they have a problem. They don't really know what the problem is, or they might be blaming themselves or someone else for the problem, but they can't really get to the root of what the problem and what the cause. Well, there we go, back to causation, right?
Right.
So what is the cause? So let's say I go down to my basement and then I find out that I have a leak in my pipes down in the basement. And then I'm like, oh, well, here's the cause. So now I have awareness. So there's the awareness of the problem. There's the awareness of what's causing the problem, but I still don't have skill. So once I have awareness, I still have to have skill or knowledge. So maybe what I might do is I might start watching YouTube videos. I need to get some tools, right? I don't even have any tools to fix my problem. So I have to be educated. I have to learn some tools, get some tools. Or, I could call a plumber, but maybe I'm so anxious I don't even have the skill to call a plumber. So there's lots of different ways. I can't ask for help. That would be a lack of skill.
Right.
Right. So now I have awareness. Now I've been doing research. Now I've got all the tools. I still have to have willingness. I still have to move into action. And so if I lack willingness, the problem doesn't get solved. Right. So now I know why the problem is there. Now I've got some ideas on how to fix it, but I still have to do it.
Yeah. So why aren't you doing it if you could?
Well, Because for me, I know personally for me, it would be like failure, right? Like fear of failure. What if I go down to the basement and I start futzing around and I make things worse and then I flood my entire basement? So I'm doing the what ifs of the future. And what if I epically fail? And then like I flood out my entire basement and then I have to do a homeowner's insurance claim. And so in my brain, I've got myself in unrelenting crisis, you know, even though I have the skills. So we'll talk about this a lot with residents. Like, what are you afraid of? What's the threat? And a lot of times they'll come up with like fear of uncertainty. I just don't know what the future holds. Fear of success. Like, what happens if I get really good at this? So if I get to be like really good, like I patch up my plumbing issues and then other people find out, other people are going to want me to like fix their plumbing, right? I think for residents, a lot of times their fear is if I'm successful once or twice, people are going to expect me to be successful all the time. So then I won't be able to fail. So like they're kind of intertwined, that fear of success, fear of failure. Fear of change. I don't know how that fits in my plumbing reference. Maybe not so much, but
We'd have to see yourself in a different way. Like if you, I mean, you could look at like the plumbing is like, is this really like masculine hands-on type thing? And then like in the relationship, like fear of change, like now are you the one that gets the stuff done around the house? Or do you,
good, yeah.
Or all of a sudden like your husband's like, oh, now you have to help us dig trenches in the backyard and we got to take care of the sloping of the
Don't
yard.
laugh, that's an actual thing.
I know. Should be drawing on real life experience, but you know, like that idea of like all of a sudden you're just thought to be the super capable person, and what if it's like he's like expects you to fix something that's new because he can't, doesn't have the time to, and then like you have to do it. Don't call somebody else to save money, and then you're in over your head.
Or vice versa, that what if it emasculates him? Well, he's been the one fixing and doing things all the time, and now I'm doing them. Then what is his role? So it could have an impact on our relationship.
Hey, Jay, how's that work? Got your wife doing your plumbing for you?
Yeah, right.
What are you doing? Getting your nails fixed?
Yeah, exactly.
Or, unless it nails fixed instead of done.
I know.
Too bad.
Oh, well, who cares? So I think that fear of change is really pervasive for people who have had some significant mental health histories, or they come from really invalidating environments, because what happens if they become healthy? You know, no one really wants to be alone. And a lot of our residents have extremely unhealthy friends. Interpersonal relationships are extremely unhealthy. Even the fear of the dynamic not changing in the family system, or the dynamic in the family system changing too much. What if I'm the only skillful person I know?
Right.
And then I'm alone.
That is probably one of the hardest things to come to terms with, I think, with residents, is that people who communicate in a healthy way and regulate emotion really well tend not to spend much time with people who don't, because it's painful. And so what happens is you become more and more effective, more skillful. You realize the pain that other people cause you by not being skillful and effective, and that you can't really maintain healthy relationships with them anymore, and you have to let them go if they can't change. But if you're a resident who came in for this much intensive work and change, is that the level you're at when you leave versus come in is so far beyond, I think, even like a lot of times average teenagers with how they communicate, that it's a lonely place to be in, to be healthy and effective, but important for their own well-being in the future.
Yeah, and I think we do, you know, not to toot our own horns, but we do a lot of work around that, preparing the residents to go home, is to say, you know, you might be lonely. Why would you stick to this anyway?
Yeah.
You know, and that's a big deal. And
what's his devil's advocate? That's a good one. Why would you do this?
Why would you do this?
Why would you want to be effective?
Right. You're going to go back to all these like teenagers that are ineffective by nature.
Parents are like, why are you asking them why they don't want to be effective? Please stop asking them that. I feel like you're trying to talk them out of it.
I know. Well, you're coping, you know, with the reality of it, and they're finding their own intrinsic reasons for it, which is going to, you know, be way more effective long-term than doing it for other people. And I think the other thing that really contributes to lack of willingness, aka willfulness, is shame. You know, I don't deserve good water pressure. Like, you know, I'm kind of lazy. You know, I just don't deserve good water pressure to get the soap out of my hair.
There are people in the world who don't really have potable water to drink in Africa. You know, I'm going to like spray water all over my body, but people don't have water to drink.
Yeah, how selfish am I? Like, I should be okay with this.
And listeners may think that this is ridiculous, but actually the average resident we work with has these kinds of ideas and fears and thoughts about the world.
Yeah, we'll be working with girls who, you know, they look at their family systems and they're like, well, you know, I have an intact family. I don't have any major index traumas. You know, my parents are well off. I get good grades. I shouldn't feel like this. I'm taking up a bed for someone who really needs it. And yet they've had like 6 suicide attempts and multiple hospitalizations. And that can oftentimes get in the way of them being able to get to the next level in treatment, because they don't feel deserving of treatment.
So So this has been an episode of All Therapists Are Jerks with Ulland
and Jo.
Thank you for listening.